When you talk about expectations of a patient, it really starts with a really good preoperative consultation. If you don't discuss something with the patient beforehand, it's always a surprise, and I just don't like surprises. I like things to be a little bit more predictable. But inevitably, if you do enough surgery, you're going to see things happen that may not meet your patient's expectations. Two most common things I think that we see with patients who want more things done later is some patients' brows are extremely heavy and they need a larger forehead lift or a brow lift to get things looking lifted higher. A lot of patients think you can cut everything out here, and you really can't because you need some of that skin to close the eyelid. So we're really conservative about not overcutting on the eyelid skin. So even showing patients when they're in the consultation with you exactly how things are going to look, or kind of approximately between their photos and showing them in the mirror how they're going to look, and taking the time to discuss that's so important. On the under eye area, you're going to swell quite a bit, and some people think they may not be at their end result yet. If they're not totally happy with that, I think we just have to remind them about the healing process taking time. Biggest thing I think patients forget about is they want to come in for one procedure, which is a surgery to fix an issue, but a lot of times it's their skin quality that's not being attended to. And so skin care, sunscreen, creating that plan for them in continuity with our aesthetics team is critically important. And then also maintenance, because rarely do you see a patient who's one and done with surgery and they're on their way. They need to do something for maintenance. And so at least giving them an idea of how that's going to look, what investment I need to make, and then how much time it's going to take. And with eyelids, it's kind of fairly straightforward when it comes to non-extreme maintenance plan, because you can wear sunglasses, which have UV protection, and a hat when you're out, and that's going to make the skin look less aged around the eye. Now, 10, 20, 30 years down the road, if you have a weight change or you get a lot of sun damage, you're going to have other things come up. I don't think any plastic surgery is ever truly permanent, but the results can last for a long time.